Cervical cancer is one of the most common cancers in the developing countries and causes significant mortality. It can be prevented through vaccination and early detection, with the WHO call for action to eliminate cervical cancer as a public health problem. Vaccination and screening for cervical cancer needs to be advocated at country level to save the lives of millions of women globally, especially in low and middle income countries. In our recent Lancet publication, led by Dr. Aung So King from Brunei, which was published on 31st July 2023, we reviewed the latest national cervical cancer indicators and barriers to HPV vaccination and cervical cancer screening in 21 Asian National Cancer Center Alliance member countries. Approximately 52%, 11 out of 21 countries, have introduced HPV vaccination for girls as a part of their national vaccination program. 3 countries reported coverage of over 90%. The importance of vaccination and screening for cervical cancer can be easily understood in our country-wise comparison, in which mortality to incident rates were high in India, Indonesia, and Cambodia when we compare to Japan, Korea, and Singapore, where vaccination and screening programs for cervical cancer have been in place for years now. Most UNCA members countries have cervical cancer screening programs, but only 5 countries reported the screening up to of over 50%. We identified the barriers to HPV vaccination coverage and a cervical cancer screening participation in our study, ensuring healthcare accessibility and affordability for women, addressing sociocultural barriers, and strengthening the healthcare system and continuum of care are essential to increase HPV vaccination and cervical cancer screening coverage, and we can empower countries to achieve cervical cancer elimination.